I'm Dana Rowangould, and I'm going to talk about what happened and is happening to transit riders during the COVID-19 pandemic. And this is work that I conducted with my colleagues listed here. The motivation for this study was to get a better understanding of the dramatic drop in transit ridership that we saw in the wake of the lockdowns in March 2020. Transit ridership has crept upwards since that precipitous drop, but it has not gotten back to pre-pandemic levels. And this is in contrast to what's happened with automobiles, which have recovered much more quickly. So thinking about prior research, I'm not going to go into detail here, but we're thinking about a couple of different things when we try to understand this drop in transit ridership. One is the important role that transportation systems, including transit, play in getting people to the places that they really need to go and how essential that is for their quality of life, and also how that varies across different populations and communities. Another thread that we're drawing from is that from mobility justice, which is that people experience transportation systems differently depending on who they are. And in particular, their feelings and their actual safety depend on who they are. And that can be because of collision risk, or it could be because of the risk of interacting with police and other things. The third thread that we're drawing from is looking at different types of transit riders. So some are riding transit because they choose to, but they have other options, whereas others are riding transit because they don't have other options, or riding transit is simply essential to their day-to-day activities. They use it for everything, not just for commuting. And during the pandemic, we did see that there was variation across neighborhoods that seemed to be related to these different types of riders. So we wanted to dig in a little bit deeper on all of these things and thinking about how the pandemic was affecting transit riders, but focusing at the individual level. So we had 3 research questions. First, we wanted to know how the pandemic affected riders' transit use for different types of riders. The second question was about why people decided to reduce their transit use for different types of riders. And the third question was about the effects of reducing transit use for different types of riders and how that reduction may have affected their ability to get to essential destinations like work, healthcare, grocery store, etc. So to evaluate those questions, we conducted a survey in fall of 2020. The survey was in English and Spanish. Our respondents were pretty similar actually to US transit riders as a whole, with a few small differences. And also our respondents are likely to overrepresent transit riders with internet access because it was an online survey. So that's kind of an important caveat. The survey asked about travel behavior before and during the pandemic. It asked about people's individual characteristics. It asked some attitudinal questions about public transit and COVID-19. And then it also, for those who reduced how much they use transit, we asked about the reasons they reduced transit and also the impact of those reductions. So what we found was that, in fact, the tendency to reduce transit use varied across different types of transit riders in relatively unsurprising ways. So Black riders and those who rely on transit were less likely to reduce how much they use transit. And those with other options, like those with access to a vehicle or those who were increasing how much they telecommuted during the pandemic, were more likely to cut back on their use of transit. In terms of the reasons, I'm going to focus here on the reasons at the bottom. Different riders had different reasons for leaving transit, and some riders were more concerned about things like harassment, interactions with police, or interactions with immigration officials. And so I just want to point out that, the pandemic was happening along with a lot of other things. So protests related to racial justice, the murders of George Floyd and Breonna Taylor, increased enforcement of immigration rules leading up to the election in November 2020. And so that's when this survey was happening. So we did see that female riders were more concerned about harassment, and Hispanic and Latinx riders were more concerned about interactions with police and immigration officials. The final question that we asked was about whether, for those who reduced their transit use, whether it led to greater difficulty accessing essential destinations. And we did find that for those who rely on transit, female and non-binary riders, it did in fact lead to more difficulty accessing multiple essential destinations. Female riders also noted that it was more difficult to access childcare. We also asked people to put in their own words how it made those things harder. And the responses really ran the gamut from, worries about risk to COVID to, it's kind of a mild inconvenience to I can't get anywhere now and I can't get anywhere safely. And similarly, when we asked a hypothetical about how a loss of transit service would affect people, the responses really ran the gamut from an inconvenience to I can't go anywhere. I wouldn't be able to get to work anymore, which is a pretty serious outcome. So in conclusion, the pandemic highlighted some differences in how disruptions to transit affect different types of riders. And that sort of points us to thinking about how we want to invest recovery funds in order to strengthen service for those who really need it most. So not just focusing on the 9 to 5 commuter who takes rail from the suburbs to downtown, but really focusing on essential service that people use to get everywhere. So often that is bus service. And there has been other writing about this, but this sort of underscored previous findings about this. If you want more information, there's a preprint. Feel free to contact me. And then there's also additional information in the slides that I'll post.